Well, Dr. Murtaza Akhter joins us now. He's a clinical assistant professor of emergency medicine at the University of Arizona College of Medicine. Thanks so much. I just wanted to first get your thoughts about how COVID-19 is disproportionately affecting communities of color here in the U.S. and how that's manifesting itself.
Yeah, I actually work at one of the safety net hospitals here in Phoenix, and so we see a significant amount of Hispanic patients here. And as you know, Arizona has a lot of Native Americans as well. And the data in our state are similar data in other states, which is that minorities are disproportionately represented for COVID cases, as well as COVID mortality, by the way. And so there are a variety of factors for that, whether you look at income or wealth or housing density, a variety of issues that are related, and some of it may be, within the race itself. But basically, the effects of COVID, while they affect everyone, it's a very egalitarian disease in some sense. It particularly affects minorities, so whether you talk about blacks, Hispanics, or Native Americans. And I see that myself in the ER here. Almost all my patients here are Hispanic, and they are disproportionately affected by COVID.
The numbers in the U.S. have been astounding, no doubt, but President Donald Trump has noted in terms of deaths per capita, it is not among the worst in the world. Is he right, and is that in fact a better number to be measuring?
If the goal is to just not be the worst in the world, that's a pretty horrible goal. For somebody who came on to say we want to make America great again, I would hope the goal is to be a little bit better than just not the worst in the world. When we compare ourselves to other OECD countries, so oftentimes Western Europe or Far East Asia, a lot of them have per capita death rates that are better than ours. We're not trying to compare ourselves to third world countries, at least I hope we're not. But for the countries that have resources like we do, we are doing pretty terribly in terms of COVID deaths per capita.
A study by Dynata and the CBS News organization concludes that nearly half of all tests in the U.S. come back too late to actually be meaningful. How so, and what's being done to get quicker testing?
Yeah, testing has been an issue for months now, and it's ironic because we knew what was coming. So we should have had time to prep for it. We did have time to prepare for it, and yet there are testing shortages. People use tests to be able to contact trace, and so you identify whether a person is sick or not to be able to tell him or her to quarantine, and then also find their close contacts. But if it takes such a long time to get the results, you don't know whether that person's infected, much less whether you need to trace the other people. Now, again, contact tracing would have been a lot more effective early on when there were fewer cases. Now there's so much community spread that even if the test is delayed, it's like so many people have it, that almost becomes a moot point. Almost, not quite. We still need lots of tests, and we need to be able to trace, and we need to get people to quarantine, honestly. We just need people to enforce that.
The CDC now says infection creates around 3 months of immunity, not longer. What does that mean in terms of efforts to create, as some have suggested, herd immunity in the U.S.?
Yeah, and remember, those numbers keep changing, whether it's 3 months or otherwise. We think that the way antibodies wane, we think that's why the immunity lasts probably about 3 months. But, we've already been talking about this with vaccines, which is probably won't be just one shot. The vaccine will probably require multiple doses so as to keep the immunity there, and that's if they work. Remember, nobody assumes vaccines will be 100% effective. We're thinking maybe 60%, and that will be pretty good, but that's not a cure. That's why it's very important, even if we have vaccines, that people continue to distance, wear masks when they're by each other, and wash hands, because a vaccine is the cure. We don't have any cure for getting herd immunity anytime soon.
Dr. Murtaza Akhter from the University of Arizona, thanks so much for joining us.